Hello dear viewers to a new episode of DocTalk. As you know, neurological disorders not only affect the child's movement or physical growth and ability, but also extends to communication and speech skills. And cerebral palsy is our subject today. And with Miss Maraheb Alqallaf, we're gonna address this condition and to know the effects not only on the child's life, but also on the parents and society. So please join us after this short break to know more. So welcome back, dear viewers, and we would like to welcome again Miss Maraheb Alqallaf. Welcome again.
Thank you so much, and thank you for having me today.
Okay, now let's talk about this main subject that we're going to address, and it's especially important for parents and for educators, teachers, and everyone. What is meant by neurological disorders, and what is the most common disorder?
Right. So neurological disorder means anything that affects the brain development, the spinal cord development, and the nerves in the brain, actually, because any damage to the brain, spinal cord, or the nerves causes impairments. It can be physical impairments, it can be speech, language, learning, behavior. So there are actually multiple impairments that can be caused by a neurological disorder. And one of the most common one in pediatrics is cerebral palsy, which is the acronym for it, CP.
Okay, but this kind of disorders, it doesn't happen, like, let's say, genetically. It could also come from external factors like injuries, like diseases. But what is the relationship between the nerve system and speech and language, especially for the CP?
Right. So for CP specifically, it does not happen because of genes or genetic disorder. It happens when the baby or the fetus is still inside the mom's womb, and it can be because of problems with the development of the brain.
Okay.
It can be because of, I had a patient actually who had a stroke while he was a fetus in the mommy's belly or the mommy's womb. And
how
eventually,
did that happen? Yeah, subhanallah.
It just happened. It's just meant to be, you know, having a stroke in the mommy's womb. And some kids actually, or some babies, they suffer from anoxia, which is reduced oxygen level during birth. That's when they have actually CP. Also. So it's most common during
delivery. So it's not, as you said,
it's before birth.
Yeah, yes. It's not genetic. It happens without any kind of signs or warnings. It just happens.
It just happens.
Okay, does that mean it's the mother's responsibility, or it happens without any mother, let's say, her maternal health is not jeopardized?
It can be because of undernutrition, mom, or because of the baby is not developing well in the mommy's womb. It can be because of, you know, various factors, or maybe the baby's size is so small,
yes,
that caused, you know, having CP. Because, as I said, it happens because of the underdevelopment of the brain.
Exactly. The brain always developed during the pregnancy.
Right.
Yeah. Okay. Now, how does language delay appear in children with CP? We know, as we said previously, that in the age of 3, that we can see the signs.
Yeah.
But how does it with CP, how does it develop?
With CP, so we know that any damage to the brain, specific areas of the brain, when they do MRI, we actually notice where the affected area in the brain, because we care about the motor cortex. It's a specific area in the brain where the signals get interpreted in this. Like when I want to move my hand, the signal from the brain, it's delivered to the arm to move. So there's actually lots of, you know, steps, because before you move your arm, you see, and then you form the idea, you plan it, and then actually you see the execution, right?
Yes.
So anything that affects it affects the signal,
or the process
happen. Or the process.
Yeah.
Exactly. So why am I talking about the motor cortex? Because it's highly related to speech. You actually move your tongue, and your tongue is composed of muscles.
Exactly.
Right? Your lips actually is made of muscles. Your mouth, if you want to chew and feed, you chew using the muscles.
These
right?
are physical activities.
Exactly. So the brain, and specifically the brain stem that has all kind of nerves, they do control our movement.
Yes. So, okay, we know that it's, as you said, it's connected highly with nerves, but how can it differ between speech difficulties and language difficulties in these cases? Okay, we know speech is moving the tongue, the face, the lips.
Right.
And now let's talk about the language, understanding the language, the science of the language.
For speech therapy, we consider the different types of nerves. So we have actually trigeminal, which is responsible for moving the articulators like the jaw. And we have the facial nerve. The facial nerve is responsible for the muscles of the face. We have also the vagus nerve, which is the 10th cranial nerve, that is responsible for the movement of the vocal folds, which makes your voice.
Yes.
So all of those nerves are important to produce language, to form the sounds of the language.
Exactly.
And as you mentioned, when the sounds are affected, it definitely affects the clarity of speech. And one of the most prominent speech disorder in CP actually is dysarthria. Dysarthria is a motor speech disorder from its name. Motor means the child has difficulty moving the articulators because of the damage. And all you can hear is very unclear sound production. The voice is affected, the resonance is affected. Some children, they do have very breathy voice quality, and they cannot form the specific move. Like if you want to produce the vowel O, they don't have it very clear. If they want to say the word ball, they have like difficulty saying the ba, having this lip closure.
Yes.
Because we use a muscle called the orbicularis oris. It's not moving properly.
Yeah.
And children with dysarthria, they might have problem with the mouth posture. They might have drooling.
Exactly.
Yes, they cannot close their mouths and
to perform and say, to produce the sounds and to produce the vowels.
Yes.
They're gonna face difficulties also in expressing their feelings or expressing the to communicate, if not expressing.
Exactly.
Yeah.
In terms of the language, it's just you notice the language delay, like not following simple commands, not having I would say their first words around 1 year and 6 months. Maybe they have difficulty babbling also around the age of 6 to 8 months.
Yes.
And when you follow the milestones and communication milestones, you're going to see a lag in the receptive and expressive language.
Well, that's very interesting. Now let's talk about the common mistakes in understanding the effect of CB in communication. There are people who doesn't understand it, but unfortunately, we're gonna take a break and then I'm gonna know the answer.
Sure.
Okay, so please stay tuned. Welcome back, dear viewers, with Ms. Maraheb Alqallaf. We're talking about CB and its effect on speech and language capabilities or abilities in children. Before the break, I asked you, what are the common mistakes in understanding the effects of CB communication in children in general, not in certain disorders?
I actually have two misconceptions that I want to talk about. The first one is some people or some parents think if the child is diagnosed with CP, it's not necessary to receive speech therapy or any kind of intervention, which is wrong, because children with CP, they might need the help of a physiotherapist to help them actually move, crawl and walk and run. Speech therapy to have better sound production, better pronouncing the sounds, and to have better communication skills in general. And in terms of OT, occupational therapy, some children, they do have difficulty like holding the pencil, or maybe they have very weak fine motor skills to dress themselves up every day. So those, I would say, rehab services are very important to help a child with CP. The second misconception is actually if the child is nonverbal, especially with a CP, some parents think they do not have the ability to communicate. which is wrong. Personally, I had so many cases of CP that I treated, and I actually used AAC, augmentative and alternative communication devices. The children actually could not verbalize the words, but their comprehension is excellent, and their cognition is very excellent. So we gave them the opportunity to communicate through a system called eye gaze, which actually is composed of like a tiny camera, and it catches the child's gaze to select some pictures or words, so they can actually communicate using the tablet.
Well, so if the child has CP, it's not necessary that خلاص he's disabled.
No, not at all, because it comes in different levels. And
because as you said, it's a misconception, social misconception, that a child born with disorder, that means خلاص he's just a number in the social record.
It's not. See, that's very unfortunate to think, because every disorder that comes, it has different severity level.
Yes.
There is mild, moderate, severe, and profound. And especially children with CP, actually, some of them, they live with us, and they went to school with us without noticing that they have CP.
Disorders, yes.
Because it manifests very differently. And some people think a child with CP, they're going to be completely paralyzed.
Yes.
Which is not. We have different types of paralyses. There is one called monoparesis, which means only one limb is affected. It can be the right side or the left side. It just depends on where the damage happened in the brain. There is actually diplegic. Di means in Latin too.
Okay.
So it can be both limbs on one side. There is quadriplegic, which is the four limbs can be affected. And we have honestly different kinds of paresis, and it's not, again, like a cookbook. It just depends on the severity.
Okay, now we know the condition. Now let's talk about the kind of tests that is to understand this disorder. Okay, what test helps in elevating language in children with CP?
So especially for CP, we do check the patient holistically. We don't check only for speech. We don't check only for comprehension. We check for, again, comprehension, social language skills, how they're putting the words together, their cognitive ability.
Yes.
And we have to do it in conjunction with other disciplines like physiotherapy and occupational therapy and behavior therapy as well. So we look at the child as a whole condition.
Okay. Now, you as a therapist, Ms. Maraheb, what is your role in speech language with children? Okay, as you said, you had some cases.
Right.
But how do you intervene in these cases?
So children with CP, it just depends on the child, again, the severity of the case. Some of the children that I used to work with, I focused on feeding and swallowing skills, because, as I mentioned, some of them, they do have dysarthria, weakened muscles, so they tend to drool a lot. They cannot control the food in their mouths, so we need to form this beautiful seal to keep the food inside the mouth. Some other children, I worked on sound production, and some of them I worked on the speed and the rate of speech.
Okay.
Some of them, they actually are very slow when talking.
Yes.
So it just depends on their skills, honestly.
Okay, so it's more like physical therapy or physiotherapy, but how does it improve? Okay, you said that you help them to control some of their physical abilities, but let's talk about physiotherapy and its role here.
So my role actually is like a physiotherapy, but for the head and neck only.
Okay.
So that's speech therapy. But my role with physiotherapy is very important. Teamwork actually is very important. For physiotherapy, they do focus on head and neck control, trunk control, strengthening, I would say gross muscles or the general muscles of the body, which is very important for respiration.
Yes.
And speech therapy focuses a lot on breathing to phonate. Phonate means how you
pronounce
and
produce the sounds.
Exactly, your voice. So if you're breathing for certain amount of time, this is really good because we speak on exhalation. We don't speak on inhalation.
Exactly.
So when the quality of the breathing is good, that's when we actually talk better.
Okay. Now I have a question. As a therapist,
Yes.
how can you see the children response in language training? I know, as you said, it's not a cookbook and each case is different. How do children respond to your therapy?
Actually, it just depends on the children. I had very interesting, kids coming to the clinic. Some of them are very cooperative and others are not. They try to avoid the tasks.
Yes.
And one of the most important things that we have to do actually is to use the things that they like. If they like a certain toy, I would have it ready in the clinic to enter their world, to teach them what they need. Some children like bubbles,
yes,
and I have to keep bubbles in my room. Some of them, they like stories.
Just like to break the barrier.
Exactly. So we have to break this ice so actually the child can trust me and let me in their world.
It's more like giving the child the control.
Exactly.
In therapy.
Exactly. That's one of the therapy tricks, actually. Child-led therapy and play-based.
Well, that's very interesting, especially for kids. And now, what is the role of integrated medical team? Let's say it's not about the therapists. Integrated team. It's from the birth till adulthood. There is a team.
Right. Yeah. So the purpose of having a team is communication. And I'll give you an example. And you see a lot of times when you're diagnosed with something, you go to different kind of specialists and different kind of doctors in different places. And it's exhausting, honestly, especially for the parent with a disabled child.
Yes, because the transportation is difficult and heavy.
It's very inconvenient. Plus, the doctors, some of them, they do not actually talk to each other. And having this integrated system of a team, it eases the communication. It just incorporates different kind of perspectives, especially when treating the child. We're not looking at the child as a symptom. We're looking at the child as a human being, supported by beautiful parents.
Yeah, just to introduce him back to back to society, to be active members in the society.
Exactly.
So we're gonna end this segment and we're gonna jump after the break to myth and facts. So please stay tuned. Welcome back, dear viewers, after this short report and with Miss Maraheb Alqallaf. Let's start myth or facts. Myth number 1: every child with CB cannot speak at all.
Not necessarily. It varies. The severity of the condition just varies. It can be mild, it can be moderate and severe. And every child has the ability to communicate differently. So I would say it's a myth, it's not a fact.
Okay. Myth number 2: CB is a progressive disease that gets worse with age. Is it true?
It's not. It's non-progressive because once the child or the baby is born with it, it just stays the same. It does not change with age. But it can get better with age when acquiring communication skills, being trained to walk or use, the wheelchair, feeding themselves. So I'm sure 100% that the case gets better with time.
Is there a certain kind of medications to give the child with CB to develop to be normal? Or it's as we said, it's like...
It's a really interesting question, and I'm sure most of the parents are thinking about this. So it just depends on the case and the underlying causes. So maybe if the child has seizures, the doctor can diagnose anti-seizure medications to control the seizures. And if there's any kind of medical treatments, like having what we call AFOs, like the orthotics, wearing different kind of insoles, could help the child, then it is gonna happen. So it just depends on the child.
Well, that's very interesting, and we hope that there will be a medication in the future. Okay, my next myth: there is no difference between speech difficulties and language difficulties in CP.
There is a huge difference, actually. Speech is very different than language.
Yes.
And mostly affected in children with CP, I would say speech disorder, where they cannot actually form the sounds properly, and their vocal quality is very different than others.
Well, that's very interesting again. Now let's jump to next myth. Physiotherapy for the body has nothing to do with the speech.
Oh no, it has a lot to do with speech.
As you said, it's for the breathing and the posture,
right,
the lungs.
for the posture and having better back and strengthening all over and the general muscles of the body. So it helps a lot, actually.
So physiotherapy is important.
It's very important
for speech and language,
especially for head control also.
Yeah, especially as you said, you deal with the head, upper.
Yes,
but to keep a head and neck straight, that will help with the vocals.
With the feeding and swallowing, and with the drooling. So the child drools a lot, and with gravity, with inappropriate head control, it's going to be even more. So
sometimes if it's not controlled or treated well, it could be severe.
Exactly.
If neglected. So my next myth is assistive devices replace natural speech.
No, definitely not. It helps the speech, actually. I know this is a misconception. People think having a communication device could replace verbal language. It is not. It actually, based on research, it supplements the language and it helps to develop vocabulary words even more than using traditional therapy.
Yes, also sometimes it encourages to stay away from devices and to get involved in physical or
one-on-one
interactions.
Exactly.
Yes, sometimes they get fed up of these and they need to express more.
Exactly.
Verbally.
Yes.
Okay, my next myth is intervention after the age of 6 is useless. It's the same of speech.
It's not useless. I mean, this age, definitely it's older than 1 year, but every age comes with certain skills, and at the age of 6 is still a good age to develop certain kind of skills, like running. We can do jumping with physiotherapy, and we can work on speech fluency and speech production. So every age is important, and we can develop something at different kind of ages.
Okay, my next myth is way far from ages. Girls are less exposed to language difficulties in CP.
No.
Okay.
So both genders actually are prone to have CP, and it exists equally. So there is no difference in having cerebral palsy.
Okay, in which population is CP more aggressive, in girls or boys? From your own experience.
That's really interesting, because I've seen actually CP in both genders equally. And because again, it does not have to do with the chromosomes, because we know in girls they do have the XX chromosome, and boys they do have the XY chromosomes. But the main problem of CP is actually underdeveloped or damaged brain, while the fetus is still inside the mom's womb.
Okay, my final myth: a child with CP cannot build friendships because of weak language.
No. Remember the case I talked about with the tablet and the eye gaze? Actually, the child loves using this AAC system to communicate with others, even though he's in wheelchair, but he knows how to greet people, how to say goodbye using the tablet, and they actually love
being around people.
Exactly, and people actually love being around this kid.
So it's not a barrier, or it's not an obstacle.
It is not.
Well, that's interesting. So that ends our segment for myth and facts. So please stay tuned for the end of today's episode after this short break. So welcome back, dear viewers, and unfortunately we ran out of time. And Ms. Maraheb, before we close, do you have any final words?
I want to tell parents to always have hope and never say never. Everything is possible. With the modern science and medicine, we can actually help the child to integrate into the system and have better quality of life. So consider this, because we're here to support you and help you.
Well, Ms. Maraheb Alqallaf, you were extremely supportive here in DocTalk for today, and it was our pleasure to have you, especially to address this kind of subjects that parents sometimes neglect. So once again, thank you for joining us.
Thank you.
And my dear viewers, again, thank you for joining us, and until next time, enjoy your day and be safe.